This is Malawi. It's a very beautiful country. It's a very friendly country and it's a very peaceful country. But it's also one of the very poorest countries in the world with a life expectancy of 37 years. As for the health service, the minister responsible says it's a catastrophe. And that's why VSO is here, to try and do something alongside the Malawians themselves in a brand new programme to make a difference, to try to help the recovery. It's no secret that the health service in Malawi is in crisis. In fact, it's in a state of collapse. And for that reason, VSO, the Department of International Development, and the Malawian government have come together with what in effect is a rescue package for the health service. It's a 6-year programme. The reality, as ever, is here on the ground in this district hospital, which is one of 26 in Malawi. The man in charge of the hospital is Dr. Johnathon Dimbleby. He's an extraordinary person, one of only 94 doctors in the whole of Malawi.
The major challenges that we face here are shortage of staff, shortage of drugs, a high maternal death rate due to women coming late to the hospital because our maternity services are not everywhere. And then we also have a problem with our budget. Yes, it has been raised, but it's too small to cater for almost everything.
VSO is bringing into Malawi volunteers from all parts of the world with all kinds of skill. Chitska Dijkstra is a 30-year-old doctor who came here from Holland in February 2005.
We have neonatal deaths because they are born too young, because they can't be fed, because the mothers don't have breast milk. We don't have any alternative like bottle feeding that we have in Europe. But it's all the small things that do matter, like the patients that I can help in theatre and the deliveries I do, the small babies that I can get to go home, and it sometimes makes you really happy. Sometimes you have days that you think, gee, what we're doing is good.
Lisa Warden is a fully qualified nurse using those skills at this training centre.
We are focusing on one aspect, that we do need nurses, and nurses can make a difference if they're trained properly and they have the motivation to do it. And in that way, VSO focusing on nursing colleges is very good and worthwhile.
Look at the country Malawi. As poor as it is, we are training nurses and doctors who, because of the economic situations, are being attracted to come and work in the UK. The Malawi-trained midwife is helping the British woman to deliver while her own sisters and mothers are dying of childbirth in Malawi.
You find that most of the people are running away from the government, maybe working in the hospitals, going to the non-government organizations. And even other people, they sneak going out to the overseas countries to find out greener pastures.
We are losing, I'm told, 1,800 women per 100,000 live deliveries. We are losing 10 persons per hour in Malawi to HIV and AIDS. These are colossal losses.
We are in a state of need. The needs are too much, but we have nothing, but life has to continue.
Your volunteering, your coming to help us in Malawi is going a long way to help us overcome this moral catastrophe.
Mwana wanga kampekesera katandipeza ine nkumati ndiboza kaya kapena ndikulola.